Hi, my name's Louise and I'm a nurse at Pagewell Medical Centre. Today I'm going to show you how to take a blood pressure reading at home. So the first thing you need to do is get into a good position, so a seat with good back support and so that you can have your feet flat on the floor. You should never have your legs crossed whilst you're taking a blood pressure reading. So sit nice and straight, feet on the floor. The other thing that's useful to have is a surface next to you, and that's so that you can rest your arm on the surface and it's supported at heart level as you're taking the reading. When you've got into a good position, sit down, relax for a few minutes before you take the blood pressure reading, preferably in a nice quiet room. You should try and avoid having caffeinated drinks, so coffee, tea, energy drinks, fizzy drinks, smoking, and exercise for about half an hour before you take the reading. Okay, so now onto the actual machine itself. So depending on the brand of machine that you've got, may look a little bit different, but they are all made up of the same components. So you've got the meter, the cable, which usually plugs in and out at the side, so just make sure that's secure, and then you've got the cuff as well. Before you start, make sure that you've got the batteries inside, and then you can close the cover back up and it should be ready to go. Okay. On the cuff, there is usually an arrow at the front and the cable runs down in the direction of the arrow. When you put this on your arm, you want the arrow to be pointing down this front of the arm there, and the cable will run in the same direction. When you put the cuff on your arm, it needs to be on a bare arm, so not over the top of clothes, because you'll get a less accurate reading. And then you need to secure with the Velcro. So you don't want it to be really tight, but secure so that it's not going anywhere. Okay. So when you're ready to take the reading, you may need to press an on-off button first and then a start button, or you may just have one button that does everything. So in my case, I just need to press the button and it will go. Whilst you're taking the reading, as I said before, get into a comfortable position, try and relax. Even if it squeezes quite tight, it might get a bit uncomfortable, but just try and relax, and then it'll start to loosen off again once it reaches the top. The other thing is, try not to talk when you're doing a blood pressure reading, because that can also make your blood pressure go up. Okay, so I'm just going to press the button and then it should go. Okay, so you should then get 3 numbers. So the top 2 numbers are the blood pressure reading, and then the bottom number is your pulse, your heart rate. So usually the best thing to do is take 3 readings and then write down the best of the 3. If somebody's asked you to do your blood pressure at home, then you can tell them the best reading of 3. Okay, and that is it.